Well, what a day. I certainly want to begin by thanking all of you. And you figure I'm going to tell you because you spend all the time here. But actually, I want to thank you for including and inviting the National Academy of Medicine and myself to be part of this really important issue. And having the confidence that by working together, we can find really great ways to address this issue. It really is about all of us, everyone in this room, why we're here, what we do as our mission. Therefore, it's about our patients, the people that we serve. And I thought that many of the discussions bring back so many human aspects of what we do. And so stories that you've heard repeatedly are really good, effective ways to communicate and remind us and to charge us going forward. When this group was put together, we said we're going to learn from each other. Certainly, I would say you would agree with me, we learned a lot from each other today. And when this group was put together, we looked about this 4 work streams. It's not all inclusive, but I think it covers many of the issues we talked about. And I think that as we put forward the conceptual model, it tries to capture many of the things you talk about, but maybe, as many people said, it needs to be weighted, prioritized, and customized for different situations for different individuals. What I did come out from this is to say, this is both, as you heard, something we can all work together to fix, but this is also about environment that we produce, environment that we can change, but also it's about the system and culture. So I keep on reminding today when you talk many times about to err as human, crossing quantum chasm, I can't help but feel that actually it's the same journey that we had about, Matt, 18 years ago. And maybe this is what it is all about. It is the journey. And as someone else used the word, Darryl say, the campaign. And we're all this together. We've learned a lot of things, and I'm not going to repeat them. But one thing I would say is we need to bring more people with expertise and different perspective to help us. Now, maybe we can get it done in this framework of action collaborative, but certainly if we're going to do consensus study, we need to bring experts into this. But you've talked about design. You talked about systems engineering. You talked about organization and industrial experts. And certainly, I think that when someone talks about a team, why not include the CEO and C-suite into the team? They got to be part of this conversation. So as we, quote, professionals, talk about among ourselves about how to fix it, let's get them in and let them understand what we're talking about, which is why we're also getting the external experts. And I give credit to Crico, IBM, and Epic all being willing, CMS, HARC, FDA, CDC, they all want to be part of this. Let's find a way to, when we talk about team, the team should include all of them so that they see the need to make changes. I was leaning over to Art to talk about when someone says there's so little investment in this area, if other industry, even for profit, they can figure it out by doing this, they can get better profit. So what's wrong with this picture? That we don't have enough investment, right? So we're going to have to find a way to really get our message out, and I think the messaging group is so important, which is why we talk about creating all those frameworks. So I just want to end by thanking all of you. But when I look back on, I've given a lot of talks on quality because of what we've done here, and we've been able to map from the initial report, 1999, going forward, the different steps, including executive memos from President Clinton, executive order, Obama's care, and the whole bit, how this is all led to one another. I think we can do the same, and we should. Thank you very much for being here. Can the speakers and the panelists come up here for a group photo? We need to memorize this. Thank you.